So some of the lessons that we've seen very clearly from Asia, from those countries that you've mentioned, they've had very clear public health messages that are understandable. There's been a high level of compliance. Their testing has been good as well. And many of them were better prepared. Some of them, of course, had been through the experience of SARS, but had made sure that their health systems were prepared for a pandemic in a way that many European countries probably hadn't. But around the world, we are seeing the toll this is taking on healthcare workers. We estimate that there could be 5.6 million healthcare workers who have become infected. Sadly, many of those have died. We know in just the last few days there are 1,500 nurses, tragically and sadly, who've lost their lives to this virus. That's the same number of nurses that we lost during the First World War. Nurses are angry about lack of preparedness, but they're also angry about the lack of support that they have received. We need to move on from the warm words into real action, because none of us are going to cope, and our economies won't recover if we don't keep our health workers and our nurses working, looking after all of us.
Those are truly alarming figures. Now, just before we let you go, I wanted to ask you one question, an idea which is being floated here in France, and that's the government apparently is considering fast-tracking training to get sort of ordinary civilians into the system to help healthcare workers. What would you think of an idea of that, like such as that?
So we need to be really careful with these sorts of approaches. Yes, what some countries have done is to attract back nurses, healthcare workers who've left the profession, who have recently retired and may still be younger. There can be big pools of nurses who may be willing to come back, help out and support. There may be some nurses with the right mentorship and support who are near the end of their education, their training, close to qualifying, who could also help out more. But we need to really be careful of any of these notions that we can just take people off the street with 1 or 2 days training. These are highly skilled individuals, and if you haven't got those skills in the workplace, in the healthcare environment, the risk is that actually it could be worse for patient safety. Infections could spread more widely if people haven't got the training, haven't got the knowledge. If they're not getting the right care, the patient who's deteriorating may be slow to detect that person. So needs must, and clearly we need to do all we can to support our healthcare workers. Be careful with this approach, but don't miss the bigger picture here as well. We need to more seriously invest in health systems and educate more health workers and nurses right the way around the world for the future.